actress Emilia Clarke has stars as a very strong female character in the HBO series Game of Thrones, but she recently opened up about one of her most vulnerable moments.
In the New Yorker magazine, she wrote about her experience suffering 2 brain aneurysms and the difficult recovery process. Dr. Mandira Mehra from SSM Health is joining us this morning to talk about the warning signs. Good morning.
Good morning.
So Emilia Clarke is doing a great job highlighting an issue that's not really talked about very often. She even called it sort of an invisible illness.
It's true, and we often think of brain illnesses, neurodegenerative issues, strokes, hemorrhages in the brain as really something that maybe affects somebody else or definitely an older population.
Right.
This is a great example. It's wonderful that she's really raising awareness to the condition itself of having a brain aneurysm or hemorrhage in the brain, subarachnoid hemorrhage, and she describes it really as being extremely scary, of course, very painful, and then she feels, of course, very lucky to have survived something like this. There are definitely signs, symptoms, things that we can look out for if you have, unfortunately, a brain aneurysm or symptoms of a brain hemorrhage. Very scary things. So, for example, if you have a sudden severe headache, I don't mean just a run-of-the-mill, okay, I have a slight headache. I mean, drops you to your knees, hard to function, hard to speak through. Other symptoms like all of a sudden nausea, vomiting, vision changes, loss of consciousness, drooping eyelids. If you have any of these alarming symptoms, you could be having something like a brain aneurysm, like she did in her case twice, or a brain hemorrhage. An aneurysm, just to review, is actually the vessels in your brain having that out-pocketing, pouching, and weakening, and then ultimately resulting in brain in the blood. This can be life-threatening. So other than the symptoms we just talked about, the really scary thing here is it can be life-threatening. So you definitely want to seek emergent care like she did, 911. You'll need neurosurgery on board, neurology on board, definitely management emergently. Things that you can look out for if you have any family history of this, especially first-degree relatives, if you are a cigarette smoker, if you have high blood pressure, if you have other drug abuse problems, and then just other congenital issues from birth, definitely look out for this. Getting a brain scan prophylactically is even a great idea. There, of course, are wonderful treatments available, life-saving treatments. Some are surgical, some are medication, some are just watching to see how bad an aneurysm or how large it really is. But really, her awareness is amazing because we know her as this warrior princess. She's such a strong character, but to really show us this time that was scary for her and what she survived, amazing.
Yeah, most definitely. We want to switch gears a little bit and talk a little bit about CBD. It's a topic that we talk about a lot on the program. You know, hemp was just legalized here, farming it in Wisconsin recently. And now the FDA is wondering how they should be looking at this substance. Can you kind of give your take on that in that conversation?
I would say, first of all, it's probably the most confusing time possible because we have some laws that are saying, well, now this is legal, and then we have other laws saying not so legal. And then, of course, by state, it's variable. And so the fact that we don't have one kind of across-the-board law makes it very confusing for not only a consumer, but also as a physician, and what's legal, what can you prescribe. I think the takeaway message here is that there are many products now that are trending, okay? We talked about jelly beans and beer and teas and topical agents and pills you can take. Unfortunately, until the FDA really cracks down and regulates things across the board, there will continue to be this confusion. Recent studies have also shown, unfortunately, products that claim that they have a certain amount of, let's say, CBD in them, which is the non-psychoactive component, but potentially the component that has some of these therapeutic values, they will always have this variable amount. So even if they claim to have a certain milligram amount, because it's not regulated, they may have it, they may not have it, they may be overdosed, underdosed, or may even have some of that THC active component. So the FDA getting involved would actually be a wonderful thing because it would help regulate it, would also help us say, what are the benefits? I think the FDA cracking down on the fact that they can't make unfair health claims is important. So we have to keep in mind here, just as a physician or even as a consumer, anytime a medication or therapy claims to fix everything, if it claims to fix neurodegenerative diseases, cure cancer, but as well as help migraines, pain, stop opiate addiction, obviously it can't do all of that. It's not a miracle drug. They did approve the first CBD medication recently, but it's specifically for seizures.
Super interesting conversation. Thank you, Dr. Mehra.
We need more study.
Yeah, appreciate that. So Packers fans are pretty